We've been updating you on the latest cases and details and numbers of coronavirus infection in our region through our coronavirus tracker desk. And after a week of speculation, the CDC is now recommending people wear face coverings when they go outside. So if you need to leave your house, the CDC recommends you wear some form of mask, and it can be a do-it-yourself cloth mask or one purchased online. The CDC is also urging the public not to buy medical-grade masks as supply is needed for healthcare workers. Now, as of right now, a statewide federal order mandating the use of masks when in public has not been issued.
This is voluntary. I don't think I'm going to be doing it, but you have a lot of ways you can look at it as follows. The CDC.
People should still abide by social distancing guidelines and only leave their homes for essential activities. As coronavirus continues to spread in Central Texas, Brazos County is now reporting 75 cases and their fifth death. McLennan has 51 confirmed cases and Bell County has 58. And speaking of McLennan County, new data released shows a large group of patients with coronavirus are in their 20s. And right now, those patients make up to 30% of positive cases. And the next largest group is patients in their 50s, coming in at 25% of the patients with COVID-19. In surrounding counties, Coryell County is now reporting its sixth case. Limestone also has 3 cases. Milam, Robertson, and Leon have 2 cases each, while Lampasas County and Falls County both have 1. Now, those cases are part of the over 6,000 positive cases in Texas right now. And sadly, 105 Texans have died from the virus. And across the country, there are more than 300,000 cases of COVID-19 globally. Over 1 million people have tested positive. The president says this coming week is going to be a difficult one as New York State and other hotspots prepare for the highest point of the coronavirus outbreak. Officials are now urging all Americans to wear face masks whenever they leave their homes. Here's ABC's Karina Mitchell with the latest.
President Trump with an ominous warning about the coming days.
This will be probably the toughest week, and there'll be a lot of death, unfortunately.
New York continues to be the epicenter of the outbreak in the U.S. The last 48 hours, the state's deadliest. 630 deaths Friday, 562 Thursday, bringing the total statewide to more than 3,500 lives lost and growing. Governor Cuomo warning the apex of coronavirus cases in New York is likely a week away, and he says his state is still not ready. More ventilators and personal protection equipment are needed to deal with the growing crisis.
Because we're not yet ready for the apex either. We're not yet ready for the high point.
But help is coming. The state of Oregon offering 140 ventilators, another 1,000 ventilators donated by the Chinese government. Governor Cuomo signing an executive order allowing medical students who are slated to graduate this year to start working immediately. Plus 85,000 medical volunteers, 22,000 from out of state, serving as reinforcement on the front lines. President Trump announcing Saturday 1,000 medical military personnel will be sent to New York City as backup.
They're going into a battle that they've never really trained for. Nobody's trained for this. Nobody's seen this.
In addition to New York, other hotspots, Detroit and Louisiana, are also seeing a dramatic increase of COVID-19 cases.
By the predictions that are in that healthdata.org, they're predicting in those 3 hotspots, all of them hitting together in the next 6 to 7 days.
Louisiana's governor extending the stay-at-home order until the end of April, warning the state's hospital system may soon reach capacity. Some doctors and nurses at Cedars-Sinai Hospital in Los Angeles calling it a battle zone.
I mean, it's a medical environment. It's loving, it's caring. But we have an enemy.
Officials with the CDC now urging Americans to wear a face covering when they leave home and continue hand washing and social distancing. These measures could help protect against the spread of the virus. Karina Mitchell, ABC News, New York.